Hai, Assalamualaikum warahmatullahi and salam satu Malaysia. I'm Dr. Malina Osman, your instructor for this topic. We are going to learn some aspect of tropical infectious diseases in Malaysia. Before we proceed, I wish we can introduce ourselves and you can submit your name, your hobby and why you opt to choose this course so that we know more about each other. Okay, what is the situation in Malaysia and historical perspectives of tropical infectious diseases? The history of health in Malaysia actually was dated back long before independence. In pre-independence era, healthcare more distributed in the area where economic activities related to the area where colonials took place. As example, the construction of hospitals during that period were to treat tin mining workers in certain states like Perak, and it has led to the state where that area having most of hospitals by the end of the 19th century. During that time, there were 15 hospitals in Perak. Concern over a possible spread of certain diseases, namely malnutrition, smallpox and rabies, it has led to the establishment of Institute for the Medical Research IMR in 1900. The establishment of IMR is in line with Conference of Berlin, which was held in Europe in 1885. So IMR during that time has been established as a center of tropical diseases research for the country. Tropical infectious diseases in Malaysia is currently monitored under Ministry of Health, of which it has a specific division, Communicable diseases, where all those data coordinated in Putrajaya. Based on the data which was documented, it has been established under CDC or Communicable Disease Act 1988 with amendment in 2011, and there are actually tropical infectious diseases which are also included in the list. For the last 10 years, among important infectious diseases in Malaysia include HIV/AIDS, tuberculosis, dengue hemorrhagic fever, hand, foot and mouth diseases, hepatitis, food poisoning, cholera, and so on. Of all these communicable diseases, we are going to discuss in detail some of them, which include dengue hemorrhagic fever, tuberculosis, hand, foot and mouth disease, malaria, food poisoning, and also certain type of parasitic infections, which are quite common at community setting, like scabies, head lice, as well as soil-transmitted helminths. Okay, how do we differentiate communicable diseases compared to tropical diseases? For your information, communicable diseases is a group of diseases of which the mode of transmission are well known, are well established, and there is a significant microorganisms which have been known to be the etiological agent for that kind of specific infection. While tropical diseases, it may involve both, either communicable or non-communicable. But then, the tropical diseases exclusively occur in tropical climate region. And be cautious that not all tropical diseases are infectious. I'm going to explain this more in our next subtopic. Okay, what is actually tropical infectious diseases? For your information, historically, this term was depicted by Western physicians when they deal with a group of army or travelers who are coming back from tropical region where they manifest certain pattern or unique diseases which they recognize have certain manifestation, clinical and symptoms, and if those patients are not treated well, the conditions are very highly associated with high mortality and morbidity. As we know that tropical condition or tropical area, they have a certain logistic where it has a specific temperature, humidity, and some of those creatures that are not present in other side of the world. So that this has introduced a condition where there are certain diseases which are only exclusively happen in this area compared to the other area of the world. But then, in current situation, with all available contemporary transportations and technology, the terminology of tropical infectious diseases sometimes has been discussed under the subtopic travels health as well. Because under travels health, it covers a lot of any other diseases compared to when we discuss only the tropical diseases. Okay, now we move to topic about the risk factors which is associated with tropical infectious diseases. From epidemiology point of view, all those risk factors can be divided into three, which are host, environmental factors, and the agent itself. These risk factors are actually determined through epidemiological studies. And these are all those factors which have been identified to contribute to the occurrence of the tropical infectious diseases, and the type of study that we usually conducted in order to determine all those factors include the case control or historical cohort. Most of the risk factors are from the environment. Example, in cholera, we have type of water supply hygiene practice, while for dengue, the plastics, empty containers environment would play a very important role to cause all those outbreaks. How the identification of the symptoms being made to know about the tropical infection in Malaysia. Those infectious diseases are either treated as outpatients at primary health clinics or as inpatients that need admission in hospitals. Both public and private institutions are made available to treat all this kind of infection. As Ministry of Health in Malaysia has certain guidelines and protocols, and they act under CDC Act 1988, the specific protocols need to be followed. And these guidelines need to be strategized in order to avoid such infective or infectious diseases end up with many individuals being affected and may overload the hospitals. Ministry has also what they have what they call as case definition guideline in order to help assist the health provision to diagnose and to classify, so that the field investigation can be done as soon as possible once it is diagnosed. Management of outbreak investigations in the related area is very much depend on the management of the individual who are infected in hospitals. As soon as the notification being made, whether they are diagnosed at hospitals or clinic, those individuals, particularly the health personnel in the field, will commence the details activities at the affected area. At this site, the epidemiological study to be conducted in details in order to determine the underlying cause, therefore determining mode of transmission. Field investigations require details field information. Therefore, the treatment of all those tropical infectious diseases is not only confined in a clinical setting. So we are going to proceed with all those relevant investigation in the field. So all contact tracing, meaning that those individuals who are apparently healthy but has history contact with the patients will also be investigated and being given treatment if needed. On top of that, the joint collaborations among agencies, sorting the community participation, and also identify all those availability related to the field logistics are also being identified. And in order to make the field investigation successful, we in Malaysia, as we know that we have a multiracial, socio-cultural background, as well as the lifestyles, this information also need to be sought out, because we found that some of practice among certain community may slow the investigation and perhaps may affect all those field activities that need to be done. So the control and prevention, perhaps together with treatment of all those infected individuals in the hospitals, are done in a condition hands in hands, where we are not only treat all those clinical cases as the individual isolated case. Okay, we are going to learn details about all those diseases, like examples about dengue hemorrhagic fever, malaria, leptospirosis, food poisoning, food and water-related infection, cholera and typhoid, hand, foot and mouth disease, and some of those parasitic infection in the subsequent slide. I hope that each individual of you can take note of all those important diseases, the tropical infectious diseases in Malaysia, so that you can appreciate that some of those cases that you may find in the hospitals perhaps very much different compared to what being documented in the textbook or in whatever being published in the journals. But it should not be something that can what we call as slow your effort in order to learn more about the tropical infectious disease in Malaysia. With that, I wish good luck all of you, and perhaps you can write to us after this what is actually your expectation to know, or your expected outcome at the end of the course. Thank you very much.